On Friday, August 8th, the World Health Organization declared the Ebola outbreak in West Africa to be an international public health emergency that requires an extraordinary response to stop its spread. The global declaration has sparked concern and some confusion about the outbreak here in Canada.
We have routine precautions in healthcare facilities, and every patient that comes in has to be viewed as being potentially infectious until we rule them out otherwise. And we put in place appropriate screening mechanisms, for example, like through the triage system where the nurse does do appropriate screening, whether that be for respiratory or other types of infectious agents. And then we appropriately protect the patient. I think there are many measures, public health measures, that we have in place in Canada that help prevent, because at the end of the day, people that come to the hospital are people that are sick, and we don't want to have what we call nosocomial transmission, that is transmissions within the hospital system.
Ebola is certainly a deadly disease, but there's very little chance of contracting it in Canada. So why the media frenzy? Well, the question becomes not about Ebola itself, but infectious diseases in general, and how equipped Canada is to handle that.
We can definitely handle communicable diseases, including viral hemorrhagic fever or Ebola. So the Public Health Agency of Canada, or actual government of Canada, has border and security officers at every single port of entry in Canada. So it's not limited to just airports. So these are border and security officers that are actually trained to perform surveillance and specific screening on symptomatic individuals returning back to Canada, not just from West Africa, from any country. So if there is an ill person on the plane, there's something called the Quarantine Act in Canada, and they're mandated to follow that. So when you're symptomatic and you're coming off an airplane, you will be screened and you will be immediately quarantined.
Canadian hospitals have sophisticated infection control systems and procedures in place that are designed to limit the spread of infection and protect healthcare workers and communities. The simple fact remains that the risk of contracting Ebola in Canada is extremely low, and misinformation about the virus can lead to growing anxiety among the public.
The virus is actually transmitted through blood and bodily fluids, so you must place yourself at risk of the exposure. You cannot get Ebola virus from someone who was in the endemic country if they're not symptomatic. You must have Ebola and be symptomatic to shed the virus.
For northernlife.ca, I'm Malka Villegas.